Thank you very much, Jerry.
Thank you, Senator Moran. I'd like to ask, get your comments on a few things that aren't concerned with the Affordable Care Act, but really about just good governance. One of the concerns, somebody, I think Senator Pryor mentioned about the concern about the slots for you know, people in the specialties. You know, right now we're in a situation in the residency programs where we have a lot of foreign medical students. You know, that are filling those slots. To me, it really makes no sense in the sense, if we're going to train foreign medical students, we should have the ability to allow them to stay once we subsidize their education. And you know, that's a real problem. I think we all agree, maybe we can argue about the extent of the problem, but residency problems are a real problem since we have more students going to medical school now. We haven't increased the residency programs. We do have a lot of foreign students. It would make sense to make it such that there were an easy way, if they chose to stay in the United States and practice, that mechanism. Can you comment on that?
Well, Senator, I think that's one of the components of the President's proposal and the Senate bipartisan proposal on immigration reform. It really is an immigration issue to increase the number of visas for highly skilled, highly trained workers, particularly those workers in critical areas who were, as you say, educated in the United States. It's, I think, sometimes called a component of the program of the staple, the green card to your diploma, and that is one of the components of the bill that will come before the Senate.
And I don't mean to interrupt, but again, in this case, I mean, we really do have a critical situation of you know, we're adding all of these patients into the system, and it makes sense, you know, if that can be done, you know, in the context of the other. If the other doesn't get done, it's something that we simply have to address, you know, as a standalone or whatever. But I think where you can really help is by really illustrating the extent of the problem. I don't think most members of Congress understand that. I know our providers do. I know that our hospitals do. The other thing is the RAC audits, and I believe, you know, very much that we need to have accountability, you know, and things. When you go have a situation though where 70% of the audit is overturned, that's not a good situation. So I would really encourage you to look at that again. Nobody hammers harder on waste and fraud, and we all agree that there's a tremendous amount of waste and fraud in the system. But I do think I would appreciate it if you'd look at it and make sure that we're not spending an inordinate amount of time on people that are trying to get it right as opposed to the bad actors. I was visiting with a lady at a medical center recently. She said her analogy was like one of the kids in the family acting up, and you spank all of them. And I think that we've got some of that going on. The last thing that I'd like for you to comment on is SGR. And I know, I'm a former optometrist, former provider. I know that we're not going to cut providers, you know, by 20, 30%, whatever we're up to now, but they don't know that. Healthcare is 17, 18% of the economy. It's a huge deal. We've essentially frozen those offices that some of them are doing well, but they can't plan, they can't do that without hanging over. And it's going to take leadership from all of us, you know, to come up with a plan. But we talk a lot about the economy and the importance of, you know, growing the economy, providing economic opportunity, but that is one of the things that truly is a wet blanket that's hanging over us.
Well, Senator, let me tell you, I'd be happy to follow up on the RAC issue that you raise, and any specific example. I mean, your case of a 70% overturn, that's always helpful, just so we can drill down on a case and use that as an example. So I would appreciate getting that. In terms of I would say the residency program, again, we are focusing on a whole array of workforce issues because with or without the Affordable Care Act, the aging of the population and the demands on providers is different. And if we're really—
the aging of providers.
You bet, the aging of providers. So we have a whole series of workforce initiatives underway and take that very seriously. We can't we can't, at the Department of Health and Human Services, change the visa situation. But finally, in the SGR, I don't think there's any bigger single threat to Medicare than the constant threat that Medicare providers will be cut year in and year out. Far too much time and energy is spent. The President's budget every year since I've been appointed secretary has included a long-term fix for the SGR. This budget does the same. We think that a transition period for a couple of years, which gets rid of the looming threat, and then actually working with Congress on a more pay-for-performance strategy moving forward is the best transition underway, and that's what's incorporated into this budget. But I couldn't agree more. We would love to work with you and other members in Congress to get rid of this yearly kind of kabuki dance that takes providers' time, scares patients, and is really not very beneficial to the notion that healthcare needs to be planned for in the future, and particularly for small provider offices. What we hear is people are taking out loans. They don't have any idea if they're going to have a payment the following week or the following month. And last year, we actually had to implement pay cuts. So we have seen this up close and personal and actually gone over the edge a few times. So I'd love to work with you on that.
Thank you, Madam Secretary.
Sure.